Our next speaker is Dr. Hitisha Mittal, and she'll be talking on the rescue of conjunctival lymphatics with retinoic acid after mitomycin C-induced inhibition in rat eyes. Dr. Hitisha.
Good morning, everyone. I'm Dr. Hitisha, and I'll be sharing my thesis with you all, which was titled Rescue of Conjunctival Lymphatics with Retinoic Acid After Mitomycin C-Induced Inhibition in Rat Eyes. We know that the post-trap bleb drainage is via aqueous veins and episcleral vessels. However, studies have shown the presence of lymphatics in these subconjunctival blebs. Studies have also shown the toxic effect of mitomycin C on these lymphatics and vascular channels. On further literature research, we found that retinoic acid has lymphangiogenetic properties which are under evaluation in experimental animal models. So we came to this question, can we counteract the MMC-induced damage to lymphatics using retinoic acid? So the aims and objectives of my thesis were to see the effect of MMC on these lymphatic channels and to see the effect of simultaneous usage of MMC and retinoic acid on these lymphatic channels. It was a prospective experimental animal study done on 30 Sprague Dawley rats divided into 5 groups. The right eye of each group was the intervention eye and the left eye was control. The intervention in group A was with balanced salt solution, in group B with mitomycin C. Group C was the dose standardization group for retinoic acid where we started with 10 nanomole concentration. However, due to lack of effect, we increased it to 100 nanomole. Group D was the combined MMC and retinoic acid group, and Group E was the DMSO group. After appropriately weighing the rats and giving intraperitoneal anesthesia and under sterile aseptic precautions, we used a 30-gauge needle to inflict injury in the subconjunctival tissue and formed a subconjunctival bleb as per each group specification. And on post-operative day 14, we enucleated and the conjunctival samples were analyzed in the pathology lab for CD31 and D240 markers. We saw what was the lymphatic and blood vessel density in these groups and what was the effect of MMC and retinoic acid on these draining channels. Appropriate statistical tests were used, which led us to the following results. Mitomycin C had a significant reduction in the conjunctival lymphatic count. However, in the combined MMC and retinoic acid group, there was a dramatic increase in the conjunctival lymphatic count. These are the histopathological slides. The first one shows the normal conjunctival tissue. The second one shows the increase in lymphatics when a local injury is created. Now in the third slide, we can see there is a decrease in lymphatic count when MMC is applied. And in the fourth slide, we can see there's a dramatic increase in the lymphatic channels when we give retinoic acid along with mitomycin C. We also analyzed the blood vessel count and we found that the combined MMC and retinoic acid group had a higher blood vessel count when compared to the other groups. Similarly, these are the histopathological slides for the blood vessel analysis. The first one is the normal conjunctival tissue. The second one shows the increase in blood vessels when a local injury is created. The third one is the post-MMC slide, and the fourth one shows the increase in blood vessels post-MMC and retinoic acid application. So to conclude, MMC has a toxic effect on the developing conjunctival lymphatics, potentially causing bleb drainage failure. Retinoic acid has lymphangiogenic and angiogenic property at 100 nanomole concentration, and simultaneous application of retinoic acid with MMC can reduce the MMC-induced inhibition of lymphatic and vascular channels. These were the merits and demerits of my study. I would like to thank my mentor, Professor Pandav sir, for giving me this opportunity. Thank you very much.
What immunohistochemical marker which you have used and what it stains?
So we used two immunohistochemical markers. One was CD31 that stains the vascular endothelial cells.
Okay,
So
correct.
that tells us about the blood vessels. The second one was D240, which is commonly known as podoplanin. That is the lymphatic endothelial marker. So we created different sections to stain with CD31 and D240 and separately analyzed them.
Wonderful.
Yes.
Did you consider the role of matrix metalloprotease in breakdown of these collagen fibers? Matrix metalloprotease, MMP. In scleritis or any other inflammation, the matrix metalloprotease plays an important role.
Yes.
Even diabetic retinopathy, matrix metalloprotease plays an important role in degradation of the collagen fibers and the walls. Did you consider, or it is in your hypothesis?
Sir, we did not consider that in this particular study because it would be common in all the rats. We thought it would be a common factor, so it would not specifically decrease lymphatics or specifically decrease the blood vessels.
I would like to
Thank you so much, sir. Thank you, sir.
I would just like to know if Dr. Virendra Kumar is here. No? Okay. So I think that yours is the conclusive talk. So I request Dr. Niladri Saha and Dr. Koyal Chakravarti to please present a certificate to Dr.